A leading plastic surgeon says he's concerned at the increasing numbers of teenage girls inquiring about breast enlargement surgery. Nick Parkhouse is based at the Mcindoe Centre in East Grinstead.
He says the number of youngsters wanting the operation has doubled in the last few years. Mr Parkhouse believes young women are being influenced by their celebrity idols and that they don't understand the realities of cosmetic surgery. Holly Lewis reports.
You can't open a newspaper without seeing their pictures. But what effect do these celebrity images have on impressionable teenagers? Katrina Duffy-Greenhow from Tunbridge Wells was determined to have a breast enlargement when she turned 18.
Girls feel like inadequate to them, and they just think, well, I want to look like that, I want to be more like that, I want to impress him or something. I mean, I don't feel like that, but a lot of girls do.
Katrina changed her mind after she was taken through the procedure by a BBC Three programme. But plastic surgeon Nick Parkhouse says she's typical of his younger patients.
Well, what we're talking about is young teenage girls who get it into their minds that they want to have bigger breasts in their mid-teen years. And, of course, going through their adolescent self-consciousness is a potentially very vulnerable time for rushing into surgery, which can have long-term consequences.
A survey by Girl Guiding UK found that 42% of 11 to 16-year-old girls restrict what they eat to stay slim. 12% would consider having plastic surgery and 5% would consider Botox. Mother and daughter Justine Fisher and Helen Wattenbach have both had their breasts augmented.
I would never have considered doing it any younger than 18, just because I wanted to feel more confident in myself by then. I wouldn't have been ready for the operation.
You've got to wait until the time where you've got through that stage of life where you're not so influenced by, you know, the glittery stardom world, and actually your feet are on the ground a little bit more and you know what you want to do.
Their message is, while plastic surgery is becoming more common, it's not something to be entered into lightly. Holly Lewis, BBC South East Today, Tunbridge.
Well, we can talk live now to another plastic surgeon, Brent Tanner, who works at the Nuffield Hospital in Brighton. He's been listening to that report and joins us now. Mr Tanner, would you ever consider carrying out surgery on a girl as young as 15?
Not as young as 15. I'd certainly see them and give them a consultation. I would find out exactly where they were, because a lot of these younger girls are very well informed. They have read the internet, they do know what they want. Okay, they may be immature, but certainly they're mature enough to speak to a plastic surgeon about it. And we go
Do you think then there should be a minimum age that girls should be allowed to actually have this kind of surgery?
Well, on the whole, the youngest people we tend to do are 19, 18, though very occasionally it's been done at 17 on very specific indications. So it's not something you rush at, but the girl's self-esteem is so much improved by the surgery, but they must know the risks.
Would you consider doing it purely for cosmetic reasons, though, rather than because somebody was actually clinically depressed about their body appearance?
No, it would have to be a clinical reason. Like they do have small breasts, they have low self-esteem, and they have done their homework, their parents agree with it, and we also say, well, come back in 6 months, we'll interview you again, see how you are and see how you feel about it. And if they continually do that, then round about 18 would be the correct age.
OK, Mr Tanner, we'll have to leave it there. Thank you very much for being with us this evening.
Thank you.